Hello everyone, thank you for coming out. Currently we'll be presenting a 4-part series entitled Social Security and Medicare 101. It will be available on Facebook, LinkedIn, and also we carry on our Camaraderie Agency YouTube channel, the full-length version. Relax. I hope you enjoy our education video.
Welcome to Social Security and Medicare 101. Current agency is not connected with or endorsed by the U.S. government, federal Medicare program, Social Security, or any other government agency. Agenda. What we will cover: Social Security overview, what is Social Security and who can participate, Social Security basics and benefits, consideration for collecting Social Security early, how Social Security and Medicare work together, turning 65 and working. Also, we're going to cover Medicare 101, understanding your options, Medicare Parts A through D, and what they cover, federal health insurance program and private plans, your Medicare option, meaning the original Medicare compared to Medicare Advantage, dual eligibility special need plan, we call DSMPs, prescription drug coverage, Medicare supplement insurance, how to get started, enrollment in Medicare when eligible, and choosing additional coverage that's right for you, and frequently asked questions. We'd like to go over Social Security review. The main requirements of the original Social Security Act was to pay financial benefits to retirees based upon a lifetime of payroll tax contribution. It was intended to be a federal safety net for providing aids and benefits for the elderly, unemployed, victims of industrial accident, dependent mothers and children, the blind and disadvantaged American. Qualifications to receive full benefits must be a U.S. citizen or resident, pay into the Social Security system for 10 years. Social Security basics. Before you apply for retirement benefits, here are Social Security basics you need to know. Your full retirement age depends on the date of your birth. This may be between 66 plus 2 months and 67. We'll go into more details later. You can start receiving benefits as early as 62. Benefit monthly payment may be reduced if you choose to receive benefits earlier. You may choose to continue working while receiving benefit if you elect to receive benefit before full retirement age. Delayed retirement credits may be added to your benefit if you start after your full retirement. Consideration for collecting Social Security early. Working. Will you work even part-time before full retirement age, FRA? Longevity. How is your health? Is there expectation of longevity? Have you saved enough money in your retirement account, your 401k, pension, personal savings, etc.? Spouse and children. Are you married? If so, what is the age difference between the spouses? Whose benefit can the spouse and or the children collect? Do you have children under 18 or in college? Full retirement age. Age to receive full Social Security benefits. If you delay your retirement benefits until after the full retirement age, you may be eligible for a delayed retirement credits that would increase your monthly benefit. Even if you decide to delay your retirement, be sure to sign up for Medicare at age 65. The earliest you can start receiving Social Security retirement benefits will remain age 62. Note, if you are born on January 1st of the year, you should refer to the previous year. If you were born on the 1st of the month, your birthday is considered part of the previous month, and your eligibility will be shifted accordingly. How Social Security and Medicare work together. Social Security Administration determines who is eligible for Social Security benefit as well as Medicare. They also carry many other administration functions for Medicare. Medicare is available to some younger Americans with disability. Social Security and Medicare are social safety programs that Americans pay into during their working years through taxes. How to determine your Medicare Part B premium based upon your income level. Typically, it's 2 years before you turn 65 is based the income on. And for example, an individual with $88,000 or less tax return or filing joint tax return $106,000 would typically pay $140.50 a month for their Part B premium. Social Security covers the original Medicare, Parts A and B. Social Security enrolls you in Part A, Medicare Part A, hospital insurance, helps pay for the inpatient care in a hospital or limited time at a skilled nursing facility following a hospital stay. Part A also pays for some of the home health care and hospice care. Note, for those who have not worked their 40 quarters or 10 years, you may purchase a Part A in 2021. You can also sign up for Part B, Medicare Part B, medical insurance, helps pay for services from doctors and other health care providers, outpatient care, home health care, durable medical equipment, and some preventive services. Working past 65 with Medicare benefits. Should you enroll in Medicare if you are still working? Question to ask: if your employers offer health coverage, do you need to enroll in Medicare? What about Medicare prescription drug benefit? Can I save money using Medicare instead of what my employer group offers? Things to know. Most workers should remain enrolled in Medicare Part A, which is free for most people, covers institutional care in hospitals, skilled nursing facilities, and other caregiving agencies. Any who don't sign up for Medicare Part B when they first become eligible might have to pay a 10% premium penalty for each year that enrollment is delayed. About Medicare. Medicare Part A through D. Let's start at the beginning. There are 4 parts of Medicare. Part A, hospital care. Part B, medical care, called the original Medicare. Part C, Medicare Advantage, private medical plans, and typically include Part A, Part B, and often Part D. Part D, prescription drugs, Medicare prescription drug coverage plans. Medicare Part A and B, original Medicare. Part A covers hospital insurance. Part B covers medical insurance like doctor's visits. Medicare Part A and B make up original Medicare. They are provided by the federal government. Original Medicare is for people 65 and older or those under 65 with certain disabilities. Part C and D, Medicare Advantage and prescription drug plans. Part C, this is called Medicare Advantage. You can buy Part C from a private insurance company. Medicare Advantage combines Part A and Part B and sometimes offer prescription drug coverage. It can include additional benefits like dental, eye care, hearing, or wellness services. You can buy a Medicare Advantage plan, Part C, if you are enrolled in Part A and B, live in the plan service area. Part D, prescription drugs. It helps pay for prescription drugs. It's only offered through private insurance company. We'll talk more about Part D later. Chapter 2, Federal Health Insurance Program and Private Plan. Can I just rely on Parts A and B? What the government pays for? Rely on Parts A and B, but original Medicare has a deductible and only covers about 80% of your Part B services. You pay 20% of the Part B service. It covers hospital, doctor visit, along with some prescription drugs, Part B. Medicare Advantage Part C. The plan will cover Medicare Part A and B, all the same benefits as original Medicare, and may include benefits original Medicare doesn't cover, like dental, hearing, and vision care. Prescription drug care Part D with most plans. Part C also has a yearly limit on out-of-pocket costs for covered medical services, unlike original Medicare. Bottom line, Part C or Medicare Advantage combines Part A and Part B benefits, usually Part D in one plan. There are plenty of options. We can help you weigh them. Your option, how to choose your plan. Questions to consider. What monthly plan premium can I afford? Does the plan cover the service I need? Can I see the doctors I want? What about prescription drug plan? It helps to pay for prescription drugs. It only offered through private insurance company. We'll talk about Part D later, so don't stress. You can choose from 2 paths. 1, original Medicare, Part A hospital, Part B medical, Part D a separate drug plan if you buy it, supplemental insurance if you buy it. Or the second choice is Medicare Advantage. Combine Part A hospital and Part B medical Most plans include prescription drug plan. Medicare Part D, if your plan doesn't include it, you may be able to join a separate Part D plan. If you choose Medicare Advantage, here are the two options. One, a health maintenance organization, HMO. You'll use doctors in the network. You might need a referral to see a specialist. Second choice is a preferred provider organization, a PPO. You can use doctors and hospitals outside of the network, but often for a higher share of the cost. What cost does Medicare Advantage cover? For 2021, for original Medicare, the cost would be $1,484 for a Part A deductible for hospital insurance, $185.50 per day for Part A co-insurance for a skilled nursing facility for days 21 through 100, and a $203 Part B annual deductible for medical insurance, and 20% Part B co-insurance for doctor service the plan covers. Medicare Advantage may include dental, annual hearing exams, eyewear and hearing aids, Part D prescription drugs, emergency Medicare outside the U.S., out-of-pocket medical costs, annual limit. Chapter 4, DSMP, Dual Eligible Special Need Plans. What is DSMP? DSMP stands for Dual Eligible Special Need Plans. DSMPs are specialized Medicare Advantage plans created for those who qualify for both Medicare and Medicaid. You must have a state Medicaid plan and qualify for a Medicare Advantage plan to be able to get a DSMP. How do DSMPs work? With a DSMP, Medicare is a primary payer for medical services, while Medicaid is a secondary payer. This means that Medicare is the first to pay for covered medical services. The Medicaid pays for the most remaining qualified costs. Some members will have remaining out-of-pocket costs. Why should you consider a DSMP? Much like a traditional Medicare Advantage plan, a DSMP can include extra benefits that original Medicare and Medicaid alone may not cover. This includes dental care, eye exam, transportation to the doctor appointment, and more. Now let's look at Part D, the drug plan. Here's how Part D works. You can buy this in addition to Part A or Part B. You have two choices. One, a standalone Medicare prescription drug plan called a PDP. Two, a Medicare Advantage that comes with prescription drug plan, Part 2 coverage. What you need to know about prescription drug coverage. A prescription drug plan has 4 stages. Stage 1, deductible. Until you have reached your deductible, you will pay the full discounted cost for your coverage drugs. Some plans have a 0 deductible. Stage 2 is called initial coverage. After you have reached your deductible, you will pay only part of the cost of your covered drugs. Stage 3, the coverage gap, sometimes called a donut hole. After your plan have paid a total of $4,130, you will pay only a part of the cost for your covered drugs until you reach the $6,550. Stage 4 is called the catastrophic coverage. Once you have paid $6,550, you are out of the coverage gap, and you will pay a set amount for your coverage drug for the rest of the year. Part D formulary. The formulary is a list of covered drugs based on most used Medicare prescribed drugs. A plan formulary may change at any time. You will receive a notice when necessary. For the most up-to-date formulary, visit the plan's website or call their customer service phone number. 6. Adding more to your coverage. Medicare supplement insurance, sometimes called MedSup or Medigap. Original Medicare covers about 80% of medical costs. MedSup can help cover remaining out-of-pocket expenses like deductibles, co-insurance, and co-pays. Medigap plan sold by private insurance companies. These help cover benefit gaps such as Part A and Part B deductibles and coinsurance. They don't include Part D drug coverage. You can buy that separately. They do cover visits to any doctor who accepts Medicare patients. If you choose Medicare Supplement, here are the options. 1. Medicare Supplement insurance. Insurance company can sell you only a standardized plan prior to 2020 as follows. Identified in most states as plans A through D, F, G, and K through N. 2nd, Medicare Supplement insurance companies can sell you only a standardized plan starting 2020 as follows. Identified in most states as plans A, B, D, G, and K through N. If you already have or were covered by Plan C or F, or the Plan F high deductible version before January 1st, 2020, you can keep your plan. If you were eligible for Medicare before January 1st, 2020, but not yet enrolled, you may be able to buy one of these policies. Bringing it all together. Step 1. Enroll in Medicare Part A and Part B when you're first eligible. Step 2. Now you have two ways to proceed. 1. Keep original Medicare and add a Medicare Supplement insurance and a Medicare Part D. 2. Buy a Medicare Advantage plan. This combines Medicare Part A, Part B,
and alternate Part D and additional benefits.
Next questions. How do I enroll in Part A and Part B? If you are getting Social Security when you turn 65, you will automatically be enrolled. If not, you will need to sign up for Parts A and B. Contact Social Security 3 months before you turn 65. If you worked it for a railroad, contact the Railroad Retirement Board. Note, people on Social Security disability will automatically be enrolled in their 25th month of disability. When can I enroll in Part A and Part B? You can enroll in the window of 3 months before the month you turn 65, your birthday month, and 3 months after the month you turn 65. What if I don't enroll in that window? You may have to pay a penalty in the form of a higher premium. When can I enroll in Part C and D? During the same 7-month window as Part B. That means they're doing it 3 months before the month you turn 65, your birthday month, and 3 months after the month you turn 65. Times I can enroll in Part C and D. From October 15 to December 7, all people with Medicare can change their health care plans. You can switch to a Medicare Advantage or original Medicare during this annual enrollment period, join the Medicare prescription drug plan, or change plans. Are there other times I can enroll in a Part C and D? You can also enroll in a Part C and D during the special enrollment period for special circumstances such as losing your employer coverage, moving to a new service area, qualifying for extra help. What if I'm late signing up for Part D? You may face late enrollment penalty. The penalty increases based on each month that you delay. This can get costly. When can I enroll in Medigap, also called Medicare Supplement Insurance Plan? Medigap has a 6-month open enrollment period. It can automatically start the first full month you are 65 and enroll in Medicare Part B. For example, if you turn 65 on April 3rd, but don't join Medicare Part B until May 25th, the Medigap open enrollment period will start on June 1st. This is the first day of the month which you are both 65 enrolled in Part B. During your 6 months open enrollment period, you can buy any Medigap policy sold in your state. What if I have health problems? During the 6 months open enrollment period, you can purchase a Medigap policy even if you have pre-existing conditions. Even if you have disability or have health problems, an insurance company cannot do any of the following: refuse to sell you any Medigap policy it offers, charge you a higher premium than they charge others who are 65 or older. What if I delay enrollment? You can apply for a Medicare policy after your enrollment period ends. However, there is no guarantee your application will be accepted if you don't meet the medical underwriting requirement, except on a certain limited situation. For example, Medicare do have trial rights, which give you opportunity to enroll in a Medicare plan and have guarantee issue. If you are able to buy a Medicare policy, there may be additional costs due to underwriting. Know your rights. All Medicare recipients have certain rights. If anyone violates these rights, you should file a complaint with CMS.
Thanks everyone for attending. You'll find today's presentation on Facebook and LinkedIn, and I hope to see you back for other Camaraderie Agency education videos.
For a free consultation, go to www.camaraderieagency.com or message us on Facebook.